I am going to report to you from the front lines what the government and the political leaders are not reporting. We have currently run out of our first use of Hilliard duckbill respirators.
In the past 20 days, I've worked 17 shifts, so I'm losing count, in nearly a dozen emergency rooms. I've lost count as well, around New York City, witnessing how every single emergency room is going through the exact same thing in terms of this pandemic.
I'm having to reuse the 95 masks that I have in my locker. I try to disinfect them, but without an autoclave or UV lighting, it's kind of difficult. I basically air them out and put them on the next day, the next shift. That's what it's come to.
I have worn the same gloves for the whole day because we didn't have enough gloves to get from Central Supply, because they locked them all up because they're rationing them. I had to wear the same N95 mask for the last 8 days. Sure, I can do that. I have done that, right? But is that good for patient care? I have no choice.
We want to take care of our patients, and we're going to do that no matter what. But right now we're not protected, and this is really dangerous because we can become infected, of course, and we can bring it home to our families, but we can also bring it to our other patients unknowingly. People do shed coronavirus when they're asymptomatic or have only very mild symptoms, and we're interfacing with folks who are at the most risk to die from this, people that are already very immunocompromised. So protecting healthcare workers protects everyone, and right now we're not protected.
So many of my colleagues who are working on the front lines in different hospitals are getting hospitalized, getting sick, or going on life support. And this just speaks to the lack of not only the manpower that we have, but also the lack of protection, personal protective equipment that we're being supplied at different hospitals.
Our hospital has implemented a new policy called universal masking. Each employee will be given a surgical mask for a week's worth of use. A surgical mask should only be used one time per one patient. This is not safe, not healthy, and puts the frontline staff at increased risk.
They're all scared, right? I've never seen a team of badass healthcare workers become so scared for their own personal safety. And how can we take care of patients properly?
And we're only at the beginning of this crisis. Unfortunately, we have a long road ahead, so this is an extremely urgent need. It's a chilling choice that's going to cost many human lives.
A lot of us are being thrown into this burning building without any protective equipment before it collapses on us.
We're having to rely on grassroots efforts. There's a group in New York that has ties to people who can buy PPE at wholesale. So I hope this video can help in that effort.